Hello, this is Sadie Morway, doctorate in athletic training student at Indiana State University. And today with me I have Nick. He's acting as our patient. And we're going to be demonstrating two different manual therapy techniques for anterior rotation of the hips. And we're focusing on the SI joint. So Nick here has got some SI joint complaints, and we're going to kind of educate him on how we're going to perform these manual therapy techniques as we demonstrate them. So the first one is a mobilization with movement to correct anterior rotation. So for this one, the patient is going to be on their stomachs. The affected side is going to be away from them. So Nick, if you have any pain or discomfort with any of this, you just let me know. But if anything, it should be relieving. So the patient's going to be going through a series of press-ups. In this case, we'll probably start with 6 to 8 repetitions of a press-up motion. So as he's going through that press-up, so that's just getting into that extension, I'm stabilizing the sacrum. So I've got one hand on the sacrum, one hand on the ASIS here. So my goal is to pull that ASIS backward, more posteriorly. Since he's got that anterior rotation, we're working on getting that back into the posterior position. So as he goes through that press up, go ahead and start. So hands by your chest, and you're just raising up, extending through, and back down. So my left hand is stabilizing that sacrum. Go ahead and go again. You're going to do about 6 repetitions. And then I'm pulling posteriorly on that ASIS, just gently. It's not an aggressive force by any means. It's just more of a guiding force. This is a really good way to mobilize that SI joint and get the hips kind of back into that neutral alignment. Okay, let's get one more here. Good, and back down. And you can always reassess where the hips are at this point in time. The second one we're going to demonstrate is called lumbar gapping. And for this one, you're going to have the patient sideline. So go ahead and face me. And again, communicate with the patient if they're having any pain or discomfort through any of these ranges. Obviously discontinue, but patient is sideline here. Go ahead and scoot a little bit more towards me. The bottom leg is going to be a little bit flexed, with that knee a little flexed. The top leg is kind of hooking just underneath that leg, so he's got a good kind of support there. The goal here is to get his shoulders to kind of lay flat on the table. They're probably not going to be able to get there. Most people aren't, but you can always help them rotate even just a little bit more depending on the patient's mobility. So I've got one fulcrum here that I'm pushing posteriorly with. My second fulcrum is going to be kind of wrapped around his hip. So the goal really here is to get a good mobility through the lumbar spine. The reason we're looking at the lumbar spine here, even when we're addressing SI issues, is it's one working unit. If the SI is having complications, it could very likely be due to the lumbar spine. So in this event, all we're doing is we're pushing down posteriorly on the shoulder. Same thing with that hip. The pressure is going through my elbow down onto his knee, and we do repetitions here. Anywhere from 5 to 10 is a good place to start. For this one, in this case, we're using it in the intermediate phases of rehabilitation. So 10 repetitions would be good in a grade 4 mobilization. So you're getting to that end range and then coming back from that. So that's lumbar gapping and mobilization with movement for anterior correction.